Good afternoon to Ste. Marie and Algoma. Welcome to Special Report Afternoon Edition for Wednesday, July the 15th. We are just waiting for Doug Ford's press conference. Today will be Christine Elliott. She'll be back, and she's the Deputy Premier, Minister of Health. And then Mary Lee Fullerton, who's the Minister of Long-Term Care, will be at this announcement. This announcement's also coming from Queen's Park. They were at a business yesterday, Eclipse, doing an announcement about N95 masks. But today's announcement will be back at Queen's Park. And now we're going to go over to Daniel to give us a quick weather forecast.
Thank you very much, Chris, and good afternoon to Ste. Marie and Algoma. Hope you're enjoying this afternoon. It is a little bit cloudier. We have some showers lingering in the area. Won't see a whole lot of sun today, but that's fine. That's going to clear up and you're going to get your sun tomorrow and Friday. So we just got to get through the rest of today. And you can look at our live view, which is sponsored by wirelesscom.ca of our beautiful waterfront and City Hall. It's a few clouds. There's a couple birds flying around down there, but other than that, not much going on. You're not going to see huge downpours that passed through this morning. Okay, so we're going to get into your current temperatures for Northern Ontario. Thunder Bay, you're sitting at 26 degrees. Wawa, you're at 19. Timmins is at 22. Here in Sault Ste. Marie, we are also at 22 degrees. Elliott Lake is at 24. And Sudbury, you are sitting at 26 as well, tied for the hot spot with Thunder Bay. Okay, getting into your 3-day forecast. So overnight tonight, we're going to see things kind of dip down, not too much, probably about to a low of 15 degrees. And then on Thursday, we're going to see a high of 27 degrees and mainly sunny. This is that high pressure, little bit of a quick high pressure system that's going to move through here, and we're going to see temperatures bump back up, and we're going to see a low of 19 on Thursday. Sun's going to continue on Friday, and we have some high UV index for Friday as well, around 10. So it's going to be very hot and sunny on Friday, so keep that in mind, and a low of 19. Saturday, things are going to change again as another system moves through and brings unstable weather. With a high of 28, the humidity is going to be a factor, and we may see some severe thunderstorms over the weekend. A low of 18 on Saturday night.
And now we're going over to Doug Ford's press conference. He is coming out. We'll possibly have some more weather a little bit later in the show. Here we go. Doug Ford.
Well, good afternoon. My friends, the last few months have made it crystal clear that when it comes to long-term care, we can't accept the status quo. Thanks to our frontline heroes, the vast majority of homes have now stabilized. But we have clearly seen the system is broken. And after decades of neglect and underinvestment, the cracks in the system can no longer be ignored. What we need is significant investment in the long-term care sector. We need to tear down and redevelop old homes, and we need to build new ones. We need thousands of new long-term care beds, and we need them fast. When it comes to long-term care, it can't be business as usual. We need action, and we need it now. My friends, we're committed to building 30,000 long-term care beds over the next 10 years. And today, we're making a historic investment of $1.75 billion to kickstart the development of long-term care beds in Ontario. Today's announcement will result in an estimated nearly 8,000 new long-term care beds and 12,000 redeveloped long-term care beds. These estimated 20,000 beds are the first step in a number of new initiatives we'll be putting forward to meet our target. And we will continue to plan for more long-term care beds until we reach our goal. And we're getting shovels in the ground. We're building new beds, and we're upgrading existing ones. We're redeveloping homes to modern design standards, so our seniors have access to features like private and semi-private rooms and the latest medical technology. My friends, we inherited a broken system. A system where tens of thousands of seniors were left on wait lists for beds. A system where seniors are waiting in emergency rooms and hospital hallways. a system where many seniors are denied the comfort of air conditioning during the summer months. It's unacceptable, and we're going to fix it. And that's why last week I committed to finding solutions for problems with air conditioning in long-term care homes. These are problems that have been around for decades. We've begun work on regulations to mandate cooling in existing long-term care homes, and today I can announce that working with the long-term care sector, our government will dedicate the funding necessary to ensure long-term care homes in need have working air conditioning. This is something that should have been done many years ago, and with thousands of new and redeveloped beds on the way, we're going to mandate air conditioning for all new long-term care projects and redevelopments. I am 100% committed to seeing this through. No longer will the seniors and the staff in our long-term care homes have to suffer through the summer heat. And this important work will take place in every corner of the province, from Windsor to Ottawa, from Kenora to Niagara, and everywhere in between. No matter where you live, you and your loved ones should have access to top-notch long-term care. My friends, together we will build a better system, because our seniors deserve nothing less. They deserve a place that feels like home, a place that is safe and comfortable. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Fullerton.
Thank you, Premier. COVID-19 has created unprecedented challenges in many long-term care homes globally and in Ontario. There are roughly 24,000 beds in Ontario's long-term care system that meet design standards from 1972. We can and must do better. After many years of neglect by previous governments, our government is taking swift action to improve long-term care. Today, we are announcing our new modernized funding model that will break down long-standing barriers and accelerate the construction of urgently needed long-term care projects across Ontario. From 2011 to 2018, only 611 beds were built. That's less than one new bed for every home in the province at a time when the aging population was increasing steadily. This was due largely because the current one-size-fits-all approach to funding long-term care development does not account for regional differences and barriers to development, including land, construction, and development charges. Our new funding model will encourage new beds to be built faster and upgrade existing homes to meet high-quality design standards with features like air conditioning and private or semi-private rooms. Our plan will create 4 new regional categories that includes large urban, mid-size, and rural. We will increase the province's construction funding subsidy tailored to each of the 4 categories, enabling us to address the needs of different communities. We will also provide development grants between 10% and 17%, depending on regional category, to cover upfront costs like development charges, land, and other construction expenses. Our government will also increase funding to incentivize the construction of basic accommodation beds and continue top-ups for small and medium-sized homes. Through this new approach, we fully expect that several thousand new and redeveloped beds will be built and in use in 2022. I'd also like to provide an update about visiting your loved ones in long-term care. I know that this has been incredibly difficult for many, including loved ones, essential caregivers, and families. Effective immediately, up to 2 people at a time can now visit a loved one in long-term care during an outdoor visit. Those visitors will no longer be required to take a COVID-19 test. Starting on July 22nd, indoor visits for 2 at a time can resume, and the previous verbal attestation of a negative COVID test will apply for indoor visits. We must continue to be vigilant when visiting our loved ones in long-term care. If you're feeling unwell, please stay home. Our government will always work to support our vulnerable populations, and by taking immediate steps to get shovels in the ground faster and get seniors into modern, comfortable homes sooner, we will ensure that they get the quality of care that they deserve. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Randy Rath from Sage CHTV. Please go ahead.
Hi, Randy.
Hi, Premier. I'm wondering the air conditioning fund that you've set up, will private for-profit operators be able to draw from that fund? And if they're able to, why would you not just say to them, you have to provide air conditioning like you have to supply fire suppression?
If you don't mind, I'll hand this over to the minister. Thank you.
Thank you. So now whatever ownership it is, whether it's for-profit, municipal, or not-for-profit, ultimately it's about resident safety and well-being and their health. So we're taking a very resident-centered approach to this. That's what matters the most, and obviously staffing in the homes as well. So we want to make sure that the residents are well cared for, and this has to be across the board, and we want to make sure that we are consistent in that expectation.
Follow-up.
Okay, and I also want to ask about retirement homes as opposed to long-term care homes. We have a home in Hamilton, the Cathmar retirement residence, that went right through the recent heat wave with very few rooms air conditioned, and finally they came in and fixed the air conditioning, and it no longer works 4 days after it was fixed. What is the government going to do to provide air conditioning in retirement residences?
So thank you for the question. I'm not going to speak for Minister Cho, but I can address the question. Retirement homes are under the Ministry of Seniors and Accessibility, but overall, I can tell you that as our government works to redevelop homes and make sure that the standards are there so that we can have an expectation that residents, whether they're in a retirement home or in a long-term care home, receive the quality care that they deserve, that keeps them safe and addresses their well-being overall. So in retirement homes as well, some of them are older buildings, and specifically to long-term care, that demonstrates the necessity to redevelop. The issues surrounding where we put air conditioning in our long-term care homes has to be a thoughtful process. There is a concerns around how air flows in those homes, and we need to be thoughtful about that process. But we want to make sure that top of mind is resident well-being. And as you heard the Premier say in his remarks, it's been decades that this whole sector has been neglected, and it's our government that is putting the dollars behind the redevelopment and putting residents at the center. That is the most important part.
Next question.
Next question comes from Tina Yazdani from City News. Please go ahead.
Hello. So I wanted to ask what the government's plan is if in a few weeks from now the loosened restrictions on visiting result in further outbreaks at long-term care homes, and what kind of feedback have you heard from the operators of the homes about how difficult it might be to enforce the new rules?
Well, before I pass it to the minister, just speaking to a lot of these families that have people that are in long-term care homes, it's heartbreaking to hear their stories. They just want to see their loved ones, but we have to do it safely and put the proper protocols in and make sure that all the guidelines are followed. But I'll pass it over to the minister. Thank you.
So thanks for the question. So we've been working with the sector to understand how they can roll out the increased essential visitors, essential caregivers plans. We recognize the importance that friends and family members have in the well-being of the residents of long-term care. And I just want to remind us all that we are still in a state of emergency in Ontario. We must be vigilant and we need to adapt as time goes on, taking the very best evidence and science that there is to inform us as to next steps. Testing is a big part of that, and Ontario has been hit harder than some other provinces, and there is no doubt about that. And so we want to make sure that the testing is there, that our homes can manage the influx of visitors that so rightly want to see their residents and loved ones in long-term care. So this is a process that we will be vigilant with and we'll be monitoring. We're working with the Chief Medical Officer of Health and the public health units to address any sparks, shall we say, that might be occurring in different regions.
Follow-up.
And this next question is from my colleague, Erica Natividad. For many childcare centers, being forced to operate at limited capacity after months of closure with no support from the government is not sustainable and could result in the loss of thousands of childcare spaces. What is the province's plan on supporting childcare centers?
Well, we're focused on childcare centers, as Minister Lecce mentioned the other day in his announcement. We'll have 91% of the childcare spaces open, and I think I mentioned yesterday our goal always is 100%, not 91%, but we're working on the balance of the 9%. But our goal always is to have enough safe places for our children to go, and that's what parents expect, and that's what we're going to do.
Next question.
Next question comes from Lucas Mayo from News Talk 1010. Please go ahead.
Hi, Lucas.
Hi, Premier. Thank you very much. If I could actually pivot to education, as I'm sure you saw today, the TDSB coming out with their draft plans, hundreds of millions more for more educators, possible cutting of French altogether. I'm just wondering, what have you thought of this? These are draft plans, obviously. It's not the final recommendation, but, what have you seen? What have you thought of what you read? I know our friends at CTV Ottawa reported on, private schools being perhaps more ready to go going into September. So I'm just curious, what have you thought of, the biggest board, what they're preparing for, at least for today?
Well, first of all, when it comes to education, our government's putting $750 million more than any other government, including ours last year, $750 million more into education, and we're putting $250 more per student. In saying that, with the TDSB, we always value their input in all the other boards right across the province. But just keep in mind that the TDSB is going to get $55 million more than they did last year. And within that $55 million, there's $23 million allocated to hire more teachers. So we'll assess the whole area of education as we're doing right now. And just keep in mind, when we came out with our announcement, and I think it was a great announcement that we're making sure that we're ready for all scenarios. That was, I think it was June the 17th, June 16th, and we were averaging 247 cases a day. That's the average. Now, a month down the road, that none of us can predict, but down the road, we're averaging just a little over 100 cases. And I just wish I had that crystal ball to see where we are in a month down the road or 2 months down the road. But I think the minister has it bang on, working with the boards and allowing them to come up with different ideas. And we always have to look at the worst case scenario. God forbid we get hit with a second wave or flu season hits. We have to be prepared. Our goal as a government is to have kids in the classroom 5 days a week, and more people I talk to, be it teachers or be it parents and school trustees, everyone's saying, hey, we want our kids in there 5 days a week. So that's what our goal is. But again, I just can't predict what's going to happen 2 months down the road, and hopefully we'll be able to have some really great results.
But thank you. In the case, Premier, though, of that you can't go to that full day class, you have to go to if certain boards have to go to a hybrid model, and you have parents that are going to have to adjust to completely rearranging potentially their work life. I mean, what's the message to those families and parents now who are potentially contemplating that reality?
Well, the message to the parents, we're working every single day. The school boards are working every single day on coming up with different scenarios, and we have the 3 different scenarios, but by the time school opens, we'll have it down pat. But again, I just wish I could see, in that crystal ball, what's going to happen in 2 months down the road, and hopefully we'll bring the cases even lower, below 100, and we'll have a little more certainty. I understand parents, when I talk to them, they want certainty in where they're going to be in September for their own jobs, but for their kids as well. And I'm sure we've all talked to kids. They're itching to get back to school. They're just itching to get back to school, and good for them. They want to see their friends. They want to start learning in a kind of relatively new normal. Let's see how that plays out. But we're working extremely hard on this.
Next question.
Next question comes from Lauren Pelly from CBC News. Please go ahead.
Hi, Laura.
Hi there. Last week, Windsor-Essex officials asked the province to take on the coordination of the response to outbreaks at farms in Essex County. Yesterday, they said they're still waiting on a response. And Leamington's mayor suggests it'll take weeks to get these outbreaks under control. So will the province take over, and how long will provincial resources stay on the ground, if so?
Well, before I hand it to the Minister of Health, I can't wait to see the people down there. Tomorrow I'm in constant communication with folks down there, be it the Mayor Santos or Mayor McDonald. Can't wait to see both of them tomorrow and actually talk to the people. And I'm going to be visiting a couple farms there tomorrow and hear it firsthand. And I've talked to the farmers as well, literally on a daily basis, and OMAFRA. But I want to see firsthand, so I'm going to be down there tomorrow. I can't wait to see the people down in the Essex, Windsor area. Then I'll be going down again. I'll go down there as many times as it takes to make sure that we have a secure environment for the workers and the farmers and the people that live and work in that region. I'll pass it over to the minister.
Well, provincially, we have been coordinating efforts in the Windsor-Essex area. Dr. Heyer has been coordinating that. We've been working with a local Chief Officer of Public Health in Windsor-Essex, along with Public Health Ontario, with Ontario Health, and with teams that we've been sending in there. We did have an assessment center opened up in Leamington. We didn't see the volumes of people coming there, so we've set up teams that can go from farm to farm. We've had a number of teams there. We've also worked with Red Cross, and we've also worked with the federal government as well, who've been providing the quarantine association for some people, some of the workers who have tested positive and need to be self-quarantining for 14 days and receiving medical attention. Red Cross has been helping with food delivery, and right now Agriculture and Rural Affairs Ministry is still coordinating the approach, which is proving to be very effective. We're still testing large numbers of people, and we are not seeing the numbers of total positives that we saw several weeks ago, but the testing is still continuing.
Follow-up?
We're hearing about people going on social media posting that they've made what they're calling mask exemption cards. They're fake, and they're using them to wear them in places where masks are now required by law. Some of them are using the Canadian Red Cross symbol. This is probably just for Minister Elliott again. I mean, what is your take on that? Do you think there needs to be stronger laws in place, perhaps from a provincial level, to make sure people aren't floating the rules in this way?
Yeah, I heard about that, and I first of all, I want to thank the Red Cross. What a great organization, and it's unfortunate that people are using their logos, and I understand they're going to possibly be taking action. But this isn't the time to put fraudulent cards to get away and be able to go into the store. To be responsible. Don't be a scammer and say that you can't wear a mask and make up some fraudulent cards. It's unacceptable in my opinion. Everyone else is wearing a mask when you go into stores. Wear a mask. Wear a face covering. If you don't have a mask, wear a face covering. But as far as I'm concerned, it's totally unacceptable.
Next question.
Next question comes from Natasha MacDonald from Radio Canada. Please go ahead.
Hi, Natasha.
Hi, Premier. I was wondering if we could get an update on the federal contact tracing app. So when it was delayed earlier this month, you said it was a question of getting all provinces on board, but now we know that Quebec is launching consultations until August 2nd at least. I'm wondering if you know when the app will be launched in Ontario. Is it going to be before that date?
Well, right now it's with the feds. We're ready here in Ontario, and maybe I'll pass to the Minister of Health. But we're ready to go on this app. I'm proud that I came from Ontario. I'm proud that our folks here in Queen's Park helped out with Shopify. I'm just grateful for Shopify stepping up and helping us out and supporting this app. I think it's important that we have it, but we're just waiting for the green light from the federal government. Maybe the minister can add to this.
Well, we are waiting for the federal government to determine when they're going to start rolling out the app. We are ready to go, and we intend to have a vigorous advertising campaign for it because, of course, it'll be available, but it's only going to be useful if large numbers of people download the app and actually use it. It's very simple. I've seen several demonstrations of it. It's very useful even for someone who's not really big into technology. So I really encourage people when it does become available, please use it. It's completely anonymous. It does not identify you personally. It only identifies you as a number being somewhere that may be in contact with somebody with COVID-19. It's been thoroughly vetted by the Information and Privacy Commissioner. It's ready to go. It's a great app and it's been developed locally. So we're very proud of it, and we do hope that everyone in Ontario will download it when it does become available.
Follow-up?
My follow-up is for Minister Fullerton.
Yeah.
So back to the fund for air conditioning. First off, I'm sorry if I missed this, but could you say how much money will be allocated to this fund? And second, we know for-profit homes have chosen not to upgrade their facilities. So how will you ensure your ministry holds them accountable to make sure they install air conditioning?
Well, we've consulted with the sector and studied the long-term care development issues for the past year. COVID-19 slowed us down a little bit, but all the due diligence that we've done to understand this issue has been worked into this redevelopment, this modernization funding plan. And the air conditioning is part of how we will move forward to make sure that the health and safety and well-being of residents is at the center. In terms of an exact number for the fund, we have to understand the current regulations, the current issues surrounding COVID as well, and understanding even the use of fans in our homes has to be considered, how we orient the fan, how they can be used. There's multiple different ways of cooling homes as well, and that has to be understood. So in the context of COVID-19, it does change some elements, but as you've heard earlier in this presser, that we will be making sure that homes have air conditioning. And I can tell you that there are no homes that have no air conditioning that are covered under the or represented by the OLTCA. But there are issues with some of the older buildings in terms of the electrical system being able to take more of a load. And all of these things have to be considered. It is complicated.
Last question.
Last question comes from Jessica Smith from Queen's Park Briefing. Please go ahead.
Hi, Jessica.
Hi, thanks so much.
Thank you.
So a few weeks back, you took a question from CBC's Mike Crawley. He asked if you were planning to give some immunity to businesses concerning civil claims related to COVID transmission like BC has done. Since then, the opposition has focused on what that could mean for long-term care homes. Can you update us today on what your plans are on this issue?
Sure. With the long-term care homes, especially the bad actors, I just don't believe in protecting bad actors. And when it comes to other companies right around the province, give you an example. Someone could go in a little mom and pop convenience store and walk out and 2 days later say, well, I got COVID in the convenience store. That's just not fair to small businesses. I know the Attorney General's office is working on this, and we'll be rolling out a plan very shortly. But I just feel we have to protect the really good businesses. Vast majority of them, but when it comes to long-term care, I don't believe we should protect people that were careless.
Follow-up?
Thanks so much.
Thank
so BC's order doesn't cover gross negligence, and it only counts if the businesses were following the public health guidance. Can you give us a sense if you're contemplating the same thing here? And to add to that, the Long-Term Care Association says the homes need this kind of protection because they're having, sorry for the traffic nearby, because they're having trouble getting adequate insurance right now. What can you do to address that problem as well?
Well, I'm sorry, we're a little muffled on that.
Hi, Weather Daniel here with your On TV Weather Minute for Wednesday, July 15th. It is another cloudy day in Sault Ste. Marie, and we're going to see temperatures go down to about 17 degrees overnight, and those showers will clear up. Getting into your 3-day forecast, we're going to see highs of 27 on Thursday and lows of 19. Highs of 28 on Friday and a low of 19 as well. We're going to see some high pressure and sun for those 2 days. Unstable weather is going to return on Saturday with a high of 28 and a risk of some thunderstorms and a low of 18 overnight. That will continue looking into your 7-day on Sunday. Highs of 27. The humidity will be a factor and there will be risk of some more thunderstorms and showers on Sunday as well. Monday and Tuesday, we return back to seasonal temperatures, highs of 25 and lows of 17. And then on Wednesday, 27 degrees with a low of 19 and sunny. This has been your On TV Weather Minute.